In this video, we are going to talk about frozen shoulder. We're going to go through the signs and symptoms that you might expect if you have it, and importantly, we're going to talk about your treatment options. And we're starting right now. Now, before we get into the juicy stuff, a couple of questions that I get asked frequently. The first one is, why does it happen in the first place? And the second one is, what exactly is it? So to address the second question first, frozen shoulder refers to inflammation, sensitivity, and adhesion within the shoulder joint capsule. Now, the shoulder joint capsule is made up of a number of different shoulder ligaments, and this houses the ball and socket joint. It allows for good fluid movement, but when this becomes adhesed and inflamed, that movement can become restricted. In terms of who gets it and why do we get it, we're not 100% sure why we get it. We think that there is something going on within the whole body system that may be related to blood sugar. Now, we do know the demographic of people that it is most common in. So it's most common in 45 to 65-year-olds. It is more common in diabetics, people with thyroid problems, people who are overweight, and people who have cardiovascular risk factors like high cholesterol and high blood pressure. The good news is that frozen shoulder is a self-resolving condition. So that means if we leave it alone and do absolutely nothing, in the majority of people, it will get better by itself. The caveat is it can last a very long time. So depending what research you read, we're looking at potentially anywhere between 12 months to 2 years. There's some research that does suggest there are a small group of people that can even have some degree of symptoms indefinitely and up to the 4-year mark. If we move on to signs and symptoms, the main two things you are going to have a problem with if you have a frozen shoulder are pain and stiffness. And this subsequently leads to difficulties with many different activities. So it's very common to have issues in terms of pain or stiffness with putting your hand behind your back. For ladies, doing bras up is very challenging a lot of the time. Putting jackets on, reaching behind you to put your seatbelt on, or reaching behind you in the car. Anything that involves moving your arm away from your body, so this movement is called shoulder abduction, that can become painful and restricted. And also anything that involves overhead activities, reaching up to put stuff in the cupboard, if you're doing any DIY at home, those sorts of things are going to become challenging quite quickly. And sleep can also be affected, so lying on that side can also be quite uncomfortable. In the early stages, when things are acute and inflamed, which we're going to talk about in a second, you may find that even any time during the night it can be uncomfortable, even when you're not lying on the affected side. Treatment and management options vary. They vary depending on where you are within your frozen shoulder journey. They vary depending on what you have and haven't tried and what has and hasn't worked for you. But if we talk about the frozen shoulder journey, it typically presents with time in a particular way, and it's worth talking about that in a bit more detail. So if we have a look at this graph, you can see the blue line represents range and the red line represents pain. And what will happen during the early stage? The early stage is the inflammatory stage. So there's lots of inflammation going on in that joint capsule, and unfortunately what that does is elicits high levels of pain. And it's really important that you appreciate, just because the pain levels are high, it doesn't mean there's something very serious or sinister going on. Unfortunately, it is just a normal part of the pathology whereby a frozen shoulder in the acute stage is just very, very uncomfortable. People often feel that it takes over their life during this stage. It really restricts what you can do, and it can have a significant impact on sleep. Now, as time goes on, what will happen is the shoulder will become progressively more stiff. So you will start to lose range alongside having relatively high levels of pain. And as time goes on a little bit further, your movement will start to come back in this thawing stage, and the pain will start to decrease. And what people often experience in this phase is the shoulder is more stiff than painful. Now, it's really important for you to have a think about where you are on this journey, because that will dictate what sort of treatment options are available to you, and we'll discuss that very shortly. But we've kind of moved away from this 3 stages of the freezing, the frozen and the thawing, and we've made things a lot more simple in terms of, is it a painful shoulder or is it a stiff shoulder? Because ultimately the treatment that we will consider only needs to address those 2 questions. So if you have stumbled across this video and you are in the early, acute, horrible, painful stage, then our job is to try and get your pain better controlled. There are a couple of ways that we can do this. If you wanted to try and manage things conservatively, then you could consider pharmacological options. So it might be worth having a chat with your GP or doctor about appropriate pain relief. Ultimately, the goal during this stage is to make sure that you are sleeping as well as possible, because what gets people down, fed up and irritable very quickly is not sleeping very well, even just after a few nights. And unfortunately, that is really common during the acute stages. So we need to get on top of that as a goal straight away. So we need to get you on some sort of pain relief that's going to calm things down. If that works relatively well and you again want to continue with the conservative treatment, then you could try some physiotherapy, and this might include some gentle joint mobilization to see if you can get things moving a little bit better, and maybe some exercises. But your pain does need to be well controlled in order for you to tolerate that. My experience most of the time for people during this phase is that they don't like exercise very much. A lot of the exercise is to try and maintain your range, and you have to get to the end of range and push a little bit, and most people just can't tolerate that. Now, because pain is such a problem during this phase and sleep is such a problem, it's one of the few conditions that we see in musculoskeletal health whereby we do offer an injection relatively early on. So if you're really struggling, a steroid injection with some local anaesthetic can really help to try and calm things down and get you sleeping better. If you're going to go down this route, we always recommend that you have a steroid injection to try and get your pain under control, followed by relatively quick physiotherapy follow-up, so that these exercises that you were struggling with before because you couldn't tolerate them, they are now easier. You can push a bit harder, you can push a bit further, and you can be a bit more aggressive with those. And then those 2 treatment interventions combined, so the injection plus the physiotherapy, can really work long term. In terms of who can administer this injection, you may find that your local GP or doctor can do a joint injection. Here in the UK, if you are an advanced physio like myself, we can do joint injections for frozen shoulder, or alternatively, if you saw an orthopaedic consultant, they would also be able to administer a steroid injection for you. So hopefully now you've had the injection, your pain is a bit better. We've mentioned that the exercise will be more tolerable. The other thing that's also going to be more tolerable is manual therapy. So if you were to see a physiotherapist that can do some manual therapy, or an osteoarthritis for that matter, you are likely to find that much more tolerable as well. And they're likely to do a couple of different things. You may find that they do some joint mobilization to try and get the joint moving a bit better. The other thing that's likely to have happened if you have had a stiff shoulder for a little while is you're just going to have secondary compensation. So tightness into sort of upper traps and around the shoulder blade area is quite common. So they may do some soft tissue techniques to see if they can reduce any tension or tightness for those secondary issues. So hopefully we've moved out of the painful stage and we are now more in the stiffness stage, which tends to be a bit more manageable, but it's still getting in the way of daily life because the shoulder just doesn't move. So what this will feel like is it's just blocked. So you take it to a point by itself and it doesn't go any further. You give it a hand and go to that same point and you just can't get any more movement. It's stuck. Now, at this point, we can continue with our conservative treatment if it's helping. So your exercise, your stretches, your manual therapy, if that's giving you some pain relief, all of those things are great. If they're working, carry on. If they're not, and you are thinking about other options, there is another type of injection called a hydrodilation. Now, a hydrodilation is an injection for stiffness with the sole aim of trying to increase your range of movement. Now, what this injection involves is putting high volume liquid under pressure into the joint capsule to try and expand and increase the space within that joint capsule to give you a bit more movement. There's saline in the injection, there's some local anaesthetic to help with pain as well straight away, and there'll also be some steroid in there as well. But the main idea is to get high volume of liquid in there to try and increase that joint capsule. Again, as with any injection, you have the hydrodilation, you have relatively quick physiotherapy afterwards, because the idea is that you do have more range afterwards, and then the physiotherapy is going to help to maintain the range that you've achieved, if not try and get you a bit more, again because things are more manageable than they were pre-injection. There are surgical options, but as with any condition, surgery is always last resort. There are two main surgeries. One is a capsular release, whereby they go into the shoulder and they surgically release the joint capsule, and the other type of surgical intervention is called a manipulation under anaesthetic. So you are anaesthetised and then they just physically move your shoulder for you. Again, both of those things need to be done in conjunction with physiotherapy to do the same things that we've already discussed in terms of maintaining and improving your range of movement after you've had the intervention. So to summarise, you have a number of different treatment options when it comes to a frozen shoulder, and they depend on where you are on your frozen shoulder journey. We have conservative options that include manual therapy and exercise and just giving it a bit more time in conjunction with optimising your pain relief. We have this other option of different types of injections, again depending on whether you have a painful or a stiff shoulder. And then lastly, there are some surgical options that we leave to the very end, only in a small number of cases. I really do hope you found today's video helpful. If you would like some more free help for your shoulder pain, then I have put a completely free shoulder ebook in the description below the video for you that you can download. And if you'd like some more bespoke personalised care for your shoulder pain, I do actually see a very limited amount of one-to-one patients each week. You can find information about that in the description as well. But either way, please do subscribe to the channel so more people see the video that you found helpful, and whilst you're there, please do like it too to show your appreciation. And whilst you're doing all of those lovely things, I will see you in the next one.